Welcome back, guys. It is Dr. Tom. Today we are tackling a huge osteo myth, which is ice fixes injuries. Yes, ice helps with pain, but is it the best thing for healing? Not always. In this short video, I'll explain what actually happens when you ice an injury, why that can sometimes slow recovery, and how to use ice smartly when it does help. Let's get into it. Ice is great for pain relief, but for long-term healing, the evidence actually is quite mixed at the moment. And in some cases, icing can actually blunt the natural repairing process. So what does ice actually do? When you put ice on an injured area, two big things happen. The skin and the superficial tissues cool down and the blood vessels constrict. That vasoconstriction of the blood vessels reduces blood flow, so swelling and bleeding are limited and the area feels less painful because nerves are numbed. That's why ice feels so good right away. But remember, inflammation is also how the body sends repair cells and clears the debris. So reducing blood flow can have a downside effect. What is the science behind this? Show that icing after soft tissue injuries may reduce pain in the short term, but there's little evidence if it changes long-term outcomes like function or time to return to sport. In other words, ice helps you feel better now, but it doesn't necessarily help you get better faster. Other lab and human studies add topical cooling can reduce inflammation, but some research indicates it can delay muscle regeneration and reduce angiogenesis, which is the formation of new blood vessels that's essential for repair. Cold water immersion after intense exercises, for example, sometimes blunted markers of repair compared with active recovery. So for muscle damage scenarios, too much cooling might actually slow the recovery. So what does this mean? In the acute phase, the first 24 to 72 hours, inflammation is messy but necessary. Immune cells clear the damaged tissues and set the stage for repair. If we aggressively block the process with prolonged icing, we might reduce the inflammatory signals needed for proper healing. That's not to say you should never ice. So what are the practical guidelines? Here's how I use icing in my clinic for my patients around acute and chronic injuries. So 1, use ice for immediate pain relief and to control acute swelling. This may be that 24 to 72 hour mark, and use it in short increments, so 10 to 15 increments. 2, prioritize movement and early loading when safe. Early movement helps with circulation, encourages proper tissue alignment and speeds functional recovery. So 3, if pain limits function, use ice to get pain under control so you can move, but don't use it to avoid rehab. When ice may be harmful. We should be cautious in these situations. Large or prolonged icing after significant muscle injury, repeated full limb hold immerse right after damage, or using ice to mask pain so you can continue aggressive activity, those can impair the body's repair signals and potentially worsen the outcomes in some models. Animal and lab studies have shown cold can actually alter angiogenesis, delay the regeneration in certain conditions, so avoid prolonged deep cooling unless directed by a clinician. So what is the bottom line? Ice is a useful tool for immediate pain relief and short-term swelling control, but it's not a universal cure, and it can blunt normal healing processes if overused. Use ice sparingly. Focus on safe early movement and appropriate loading. If you found this video useful, we have plenty of other videos that go into specific injuries and what you should be doing. So if you are unsure and you are carrying an injury at the moment, check our great channel out. So take care, guys, and we'll see you next time.